Well, hello and welcome to Raj Sabha TV. You're watching India Fights Back with the host Rajat Kain. Well, in this episode, we'll take up a new phase of India's vaccination drive. We saw on the first day itself, India vaccinated more than 86 lakh people, which is a huge number. Experts says the drive, which obviously will continue, would have at least on the base 45 to 50 lakh people vaccinated each day or every day to say off, and this may touch 60 to 70 on the minimum basis. Now, how important is to ramp up vaccination? That's we are discussing in the show on a regular basis. At the same time, as we have launched this a new phase whereby center is procuring 75% of vaccines, whereby private players are procuring remaining 25% of vaccine, is really important so as to go ahead and immunize a large number of people, and especially in the wake of what we keep hearing about a third wave, the hypothesis that we're talking, and a catastrophic second wave of COVID-19, which India just experienced in the last couple of months. Well, to discuss further on this issue, we're joined with Dr. Raman R. Gangakhedkar. He's member National Task Force for COVID-19. Many thanks, Dr. Raman Gangakhedkar, for joining us, and Urvashi Prasad, Public Policy Specialist, Niti Aayog. Many thanks, Urvashi Prasad, to be a part of this show. Let me start with you, Dr. Raman Gangakhedkar, sir. We saw a first day, very promising first day in terms of numbers of people immunized. 86 lakh plus people were immunized. What different do you see this time around whereby we touched this huge number of people?
One of the things which we have to realize is, firstly, we had sufficient stocks to immunize everybody, and then the second wave is just on the decline mode, and the scare that is related with COVID-19 acquisition, the issues that surrounded the fear of death, that was envisioned by all of them when they were watching TV or reading anything, that has reduced the vaccine hesitancy to a very large extent. I think if we cash on this particular movement at this point, we will be able to have large number of people who could be immunized at this juncture, given the fact that this is the most receptive movement where vaccination would be a easier process for a significant rollout.
That's really important. Many thanks, Dr. Raman Gangakhedkar, for your opening remarks. Certainly, we'll explore more possibilities and scenarios of ramping up the vaccination drive. Urvashi, from the perspective of the government, how important was to change the policy? Like what we experienced in second wave, overruling even like people who were doubting that there won't be second wave. There was this, there's this, it's just a hypothesis, but it happened. It happened for real, and then government kicked in. It actually changed the policy in terms of procurement. How important was that move?
I think it was very important, much needed, because the original sort of greater decentralization that was brought in to give the states obviously a greater role and say in vaccination and how it happens. But I think the way the pandemic is, you need to keep making course corrections. You need to keep making changes based on how the ground realities are panning out. And so in the best interest of ramping up this vaccination process and making manufacturing procurement much more smooth, it was decided that the center should sort of again take on a much broader role. And that is why that shift in policy was brought about. Of course, many other steps have also been taken in parallel, as you would be aware, in terms of ramping up vaccine manufacturing and bringing in additional vaccines, giving them approval and trying to get them into the country as quickly as possible, and various other such measures. So I think the policy on this, it's gone in the right direction, because the more the center can take over or take charge of this procurement process, the states can then focus more on the distribution, on reducing wastage, on addressing hesitancy, because those are all equally important issues that need to be addressed at the grassroots level, and states are obviously best positioned to do that. So I think this is a phase where we can expect that, this center state partnership and this new sort of equilibrium, or with this shift in policies, can really allow us to ramp up the coverage the way we saw yesterday. We had a very, very good day. And hopefully, if we can keep this up, then we can ensure that this third wave that we are all fearing, its impact can really be kept to a minimum.
Right, right. So clearly, more vaccination drive, of course, is dependent on the number of vaccines center is able to procure and distribute to states. Well, the onus is therefore on the states. Dr. Gangakhedkar, how important therefore it is for states to have their apparatus ready. Center can get the vaccines. Administration of vaccines to the last recipient is therefore the duty of the state administration. How important therefore it is to have states ready for this drive, or rather to have this, at least these numbers to continue the way they are yesterday.
Yeah. I think basically health is a state subject, and therefore they have complete healthcare infrastructure which penetrates right up to small village levels as well. Now, given that they have the infrastructure and that the center is providing them vaccines which otherwise they were expected to procure even from the manufacturer, and a small proportion was to be given by the center. Now that policy is gone. The result is now they cannot complain that we don't have vaccines and therefore I am unable to roll it out really well. The issue is now that vaccines would be available to them. Now they have to ensure the safety of their own people within the state by ensuring that they mobilize the community, by ensuring they transport a required quantity of vaccines to different places which are identified as sites for vaccination, ensure that there would be people who would be willing to help out those who are digitally perhaps illiterate or semi-literate, and try to help them somehow to manage and capture that particular data in COVID. You also need to ensure that all your staff that is required to man those sites of vaccination is adequately placed, because when you roll out, one of the things which the state government will have to do is place the staff in those different.
Right, we seem to have some problem with Dr. Gangakhedkar's connection. We'll be able to fix it back soon. Urvashi, you know how important therefore here it is for the public to have an active participation in this drive, to have more and more vaccination, more and more jabs. At the same time, respecting and following COVID appropriate behavior.
Yeah. No, that is absolutely critical, because the supply side is at the end of the day, it's one side of the equation. The demand, as we say, which is where people really come in, is equally critical. And we have seen that there are different pockets of hesitancy, different types of hesitancy, different types of misconceptions or myths that go around. The social media can sometimes play a very dangerous role also. Social media can play a very powerful role, but equally, sometimes, we've had these WhatsApp forwards going around that, those who get the vaccine, it's very dangerous, you can lose your life. And, so these are the kind of things we are seeing on the ground, which need to be very actively tackled. Now, of course, the governments have to play their role, but equally civil society has a very big role to play, because the kind of reach NGOs have in every part of the country, even all governments might not be able to at this time reach to this extent, because governments are preoccupied with so many other matters related to the pandemic at this point. So the civil society, NGOs, have a very big role to play. The resident welfare associations and other groups of citizens, volunteers, youth, students, children. So I think we need to really call upon every possible person in society to say that please do come forward, please help us to address the myths and misconceptions, remove the hesitancy, so that we can, going forward, as soon as the supply is there and we can see that it is there now, we just don't lack on the demand side, and we can ramp it up as quickly as possible.
Right, right. That's really important. Dr. Gangakhedkar, if you are with us, sir, let's continuing on, this question of vaccine hesitation, of course, rumors, and there have been individual statements whereby people have raised doubts about the vaccines, they have raised doubt against doctors and, medical science in general. So how detrimental these things are for such an important critical program that we are carrying so as to counter this COVID-19 pandemic?
Yeah, it is extremely critical because you cannot reach the last mile, which you would require yourself to reach in terms of the proportion of population that is saturated with the vaccination per se. But at the same time, there is one thing, as I said, this is the best moment. If we can't do anything here, we will never be able to do the good that we have in our mind. The reason is, this is a time when even if they read social media, those visuals that they have seen on TV, those issues that they have read in newspapers, they are going to make so much of difference in reducing vaccine hesitancy that they would not bother about
Right.
those messages as much, because now their risk perceptions are fairly high at this moment. The second thing which is also important is, it is important that you need to involve the civil societies, and hopefully civil societies will join at this juncture. That movement has its own issues as of now, because it would essentially means you need well sensitized NGOs, those who are willing to work when the pandemic is still on, albeit at a slightly lower level of outbreak. But that effort has to be made by the state governments to make them move. And the third thing, which is most important, was when you had such an explosive kind of outbreak, which was not imagined by anybody. The rate of
Right.
rise was so high that the entire healthcare infrastructure, the healthcare workers, were so heavily challenged with these numbers that probably focusing also on provision of vaccines was as much challenging at that juncture. But now that these numbers are declining rapidly, what will happen is the state governments would be able to mobilize the teams, ensure that there would be a good kind of a camp-based approach, try and ensure that the vaccines are delivered in the shortest possible time. That particular challenge will also ensure that people will see vaccination sites around their own houses, around their own residential areas, and that also helps you reducing vaccine hesitancy. As the numbers will increase, every person who had vaccine hesitancy would ask a question to oneself: if my other friends have already received vaccine and now they feel they are safer than me, why should I not go myself and get myself vaccinated? So I think this is the best moment. We
Okay.
have to ensure that we don't lose this moment to ensure that the rapid scale up can happen, at least especially quickly enough in 45 plus population.
Sir, before I go off to Urvashi, I'll ask the same question to her, Dr. Khedkar. Are we still seeing in terms of vaccination the rural-urban divide? As we saw, there were some reports that there are private hospitals, a lot of vaccines are still lying to be used, whereas in rural belt, there are certain places where there is a shortfall of vaccine. So are we still seeing this divide?
Yeah, I think yes. No,
Okay.
the reason why this divide was there was because of low level of risk perception of COVID-19. One must remember those areas are less population dense when we talk of rural areas.
Yes.
The outbreak in the first wave was not as severe in the rural areas. The result is, even if we kept on telling them that you need to take COVID vaccine, once we that was approved in government by the government of India for rollout, that receptivity was slightly lower because their past experience told them that this is not a very severe or serious kind of infection. because nobody in my household, nobody in my
Right.
neighborhood or in my small village or an hamlet got this particular infection. But now in the second wave, what exactly has happened is it's just the reverse. The urban areas where we had a severe outbreak, it went up rapidly and it has come down. But if you actually look at what's happening in the rural areas continue to have this particular outbreak, even
Okay.
as much severe as we could imagine at this juncture, given the small differences here and there with respect to population density. You will find that now they will be extremely receptive, because having had
Right.
seen what happens if you don't take vaccine, hearing about vaccines, that's going to make difference. I think what is important is we have to bring back the old public health era, where we
Right.
activate the self-help groups that we have
Yes.
created in the villages. The self-help groups will have to be involved rapidly and dramatically, and also perhaps try and make effort to ensure that CBOs support these initiatives at this juncture, because these particular pandemic years have also reduced their reach to the community, and we need to, the state governments will have to make necessary efforts to try and rejuvenate that entire process of making a difference through NGO and CBO
That's
sector.
really important. Really, really important, Dr. Khedkar. Urvashi, you agree that both rural and urban areas, they have to be brought on a parity, especially when the tools of communication are, or rather tools of messaging seems to be different for the urban belt. They're receptive towards a different sort of tools like, online platforms and Facebook, Twitter, advertisement, whereas in rural areas, there are still conventional methods for communication or dispelling any doubts.
Yes, absolutely. See, in a country as large as India and with any large scale program that we're trying to implement, there's invariably these inequalities. There's geographical inequalities. So, rural, urban. There are gender related, inequalities. We have reports in certain areas where fewer women have got the vaccination as compared to men. Income related, inequalities. So there are all these inequalities which invariably, in a country as large and diverse as ours, we do need to address. And of course, the strategies for addressing each of these are obviously a little different and have to be customized. But on the rural urban specifically, it is true that our approach obviously has to be different for these areas. Now, of course, unfortunately, in the second wave, we've seen a lot of rural areas also get involved. So that should, it's an unfortunate way for awareness to happen there or for hesitancy to go away. But hopefully that would mean that at least going forward, to some extent, people are much more willing to come forward and get vaccinated. But the kind of myths and misconceptions prevailing there will also vary, from one part of the country to the other, in terms of why people still fear, this vaccine. So those will still need to be very much addressed. And that is where I feel that especially the local community-based groups, the self-help groups, the village pradhans, the civil society, they have a very big role to play, especially in our rural areas, because they can speak in the language that people would resonate
Right.
with. They can address the fears in a manner in which people would understand. And they can actually help to take the vaccine to people, rather than always expecting that people should come to the vaccine. In some cases, you might need to take it to them because, you can have very remote or very far-flung areas where, you need to be taking the vaccine to them. So that is why the emphasis on all these different types of groups, community-based as well as civil society, getting involved so that they can really assist the district administrations in reaching out to literally the last mile and reaching out to each and every person that can possibly be covered.
Right, right. Oroshi, messaging, obviously, we will always take the vaccines to the last person. But at the same time, in terms of the logistics, have we worked out logistics, especially after the second wave? Like, where do we stand in terms of that?
Yes, so again, logistics. I mean, I can not say, and nobody can say that we wouldn't have any challenges because again, we are talking of a massive, massive scale.
Right.
So we'll have to continuously, obviously, look at challenges that are arising. But a lot of preparation has gone in, and that's been going in actually for several months now. Whether it's in terms of the cold chain, whether it's in terms of, training the human resource, getting the supplies in place. So a lot of that boosting, of those supplies, that preparatory work has been ongoing and is, of course, continuing. But we will need to remain alert to obviously any challenges or gaps that come up. Wastage is something I mentioned as well as upfront, that vaccine wastage is also something we need to continually
Right.
address, because vaccine is so precious that we can't be afford to be wasting doses. So I
Totally.
think there is a lot of preparation, and to some extent we have tried to plug a lot of the gaps, but it's very much an ongoing thing. And so the center, but especially the states, because since they are the ones there on the ground, will need to keep doing these course corrections, and will need to keep flagging, whenever there is a particular lacuna that is, coming up in the process.
Right, absolutely. So these lacunas have to be addressed and have to be plugged so as to have an extremely successful immunization program for a country as large and vast as ours. Dr. Khedkar, as we're about to go to the close of the show, sir, one question that we keep often hearing is about intervals between the two vaccines. I mean, is there a possible revision on that, or it'll stay, at least for time being, the same as it is today?
Yeah, I think there are two kinds of approaches that one has to keep in the mind. One is, whether we should change based on scientific evidences. Perhaps, we could still continue on the path that we have been, and perhaps
Okay.
reduce that interval in view of the fact that a newer variant may challenge us with the increased interval that we have at this juncture.
Okay.
But at the same time, there is another factor that we have to keep at the back of mind, and that is, if you keep on changing the interval between two dosages frequently, it has happened every 2 months. Now, if it has happened every 2 months, and if at the end of, if the recent change will go back again towards the earlier interval, you might find that it may create a kind of a confusion and mistrust as well. So considering both these aspects, one may have to take a balanced view, a balanced risk, and one may have to even take steps and ensure that the fears that you have with both the strategies, if you were to go one way or the other, are addressed adequately to ensure that people are protected quickly.
Right, right, absolutely. Well, there we have these two experts in the show elucidating on extremely important aspect of vaccination and rather several aspects of vaccination, messaging, and of course, like how to address vaccine hesitation, same time emphasizing on need to get vaccinated as soon as possible, the ones who are eligible to get vaccinated. Well, that's it in this edition of the show. Many thanks, Dr. Raman Gangakhedkar, for joining us. Many thanks, Urvashi Prasad from Niti Aayog, to be part of this show. Well, before we leave, just as experts keep emphasizing on this show, please follow COVID-appropriate behavior, keep washing your hands and face on regular intervals, keep wearing a face mask, and do not forget to maintain social, rather physical distancing, I beg your pardon. These are small things that can help us in defeating the pandemic. Thank you. Goodbye.